Good afternoon, everyone. This is Tulio Siragusa with Dojo Live. I am joined today by my co-host Carlos Ponce outside of Mexico City, Kim Lantis in Hermosillo, Mexico, and Josh Scales, who's our guest from Uniti Health. Today is Tuesday, June 30th, 2020, and we are talking about telehealth. We're going to get right into that in a little bit. Should be an interesting conversation. But before we do that, let's, Josh, please introduce yourself to the audience. Tell us a little bit about yourself.
Hello, everyone. My name is Joshua Scales. I'm from Tennessee. I'm a Tennessee native. Been here my whole entire life. I currently reside in Nashville, Tennessee, where I own and operate Uniti Health, which is a virtual digital health strategy firm. And pretty much, man, I'm typical. I like to work out. I like to spend time with my kids, like to travel, and do all the other things that a lot of you, I'm sure, like to do. And which with COVID happening now and kind of shutting things back down again, I was kind of getting excited that I was going to actually start getting to move around just a tad bit more, but I guess not. So I guess I'm looking forward to being locked in the house for another month or two.
Yeah, it really sucks. I just noticed that like California's on the list of states that need to quarantine if you're visiting like New York, New Jersey, or Connecticut. I'm like, there goes visiting my mom for her birthday in August. So much for that. But anyway, Josh, tell us a little bit about Uniti Health. You're the co-founder and CEO, correct? Tell us what it's all about.
Correct. So Uniti Health, we're a health information technology firm focused on digital and virtual health innovation. So basically what we do is we help large hospital organizations, independent providers, anyone who provides care to a group of patients. We help them develop, implement, and support their telehealth or digital health programs, right? So technically, we can come in and actually serve as your telehealth team from soup to nuts, everything from strategy all the way through implementation, and then helping you even develop the sustainability program to ensure that, even if a lot of companies are getting grant dollars to fund their projects. So what happens once the grant money is dried up? We can help you develop a sustainability plan to ensure that you could continue to do that post those dollars. Yeah. So my background. Go ahead.
I got a million questions, but it's very timely discussion. Maybe Kim can introduce the show today. Let's go right into it because we want to learn more of what gave birth to this idea. Go ahead, Kim, please.
Sure. Talking about timely, the title for today's talk is Telehealth, the New Normal. Was COVID the tipping point for telehealth? So, Josh, why don't you please tell us a summary of what telehealth might be, how long it's been around, and if in fact you feel that COVID has been the tipping point?
I mean, telehealth has been around for decades, right? And prior to COVID, a lot of the regulatory requirements, reimbursement restrictions, payment restrictions, and licensure problems have really halted the greater expansion of telehealth in the United States. But once we had, a national emergency, which COVID kind of set us to that status, telehealth was really one of the only things that can help physicians mobilize and continue to provide care for those patients that they care for, and also minimize exposure to the virus at the same time. So it was very rare because I've been advocating for telehealth, past 5 or 6 years. And now it's such fresh. I hate that it had to happen this way, being that we had to have a pandemic occur just for organizations and providers and everyone just to really accept it and realize how convenient it is for the consumers and / patients, and for two, how it can help the doctors accelerate what they do on an everyday basis.
Right. So obviously you yourself, I guess, we could consider an early adapter to the telehealth sphere. I definitely consider myself, I guess, a late adapter. I've never, ever experienced telehealth. Okay. I have, I guess, in my mind, what a session with a physician might look like. But could you walk us through what the process generally is, what it looks like, and the technology that's involved?
Right. So you have different forms of telehealth, right? You have provider-to-provider telehealth, where, for example, let's say, for instance, you have a rural hospital that doesn't have a full-time neurologist on staff. Well, they're starting to see an occurrence of patients that present with stroke-like symptoms. So therefore, it means they need access to a board-certified neurologist so they can provide, the consult to the physicians that are working there, so they can determine what needs to be done for that patient. So what happens is the patient would come into the hospital. The intensivist would then call the board-certified neurologist either on the telehealth cart or similar to what we're doing now, give them, the rundown on the patient and their current status, and then that board certified neurologist will provide recommendations for that patient to that clinician. And what that does is a lot of intensivists, if they're not trained in a specific specialty, they're not comfortable with making decisions like that on a stroke patient, because, with stroke, a few minutes can determine, walking or not walking or life or death. So in those situations, it's really beneficial for those groups who lack a neurologist or a cardiologist or psychiatrist, et cetera, which are the most important, the most commonly used ones in reference to provider. Then you have direct to consumer, which is similar like what we're doing, where if you have your iPhone at home and let's say you're starting to get a sinus infection and you have done this a million times, so you know what your body feels like when it's happening, but you don't feel like going and sit 2 hours in a doctor's office and could possibly contract something else while you're sitting there, you could have a live virtual visit on your iPhone, your iPad, whatever tablet you may have, with the doctor there, and they're sending your prescription to your closest pharmacy without ever having to actually get in your car and drive to the office and wait in the office and go through the whole process, that we all do when we go to an in-person appointment. But really, there's been a lot of telehealth is only a tool. It's not trying to replace physicians, because you hear, depending on who you're talking to, that, oh no, telehealth is not XYZ. No, it's only a tool to help accelerate what doctors do now and help provide more convenience to us as patients and consumers.
So I had one experience, telehealth experience, and it was my doctor was actually on vacation, and it was exactly what you mentioned. I knew what was happening, like it's happened before, and I was like, I just need a Z-Pak, right? And it was amazing. Like I got a doctor who took on some information and wrote a script and sent it in to the pharmacy. It was like, wow. So I know you said that it wasn't designed to replace the patient-doctor relationship, the in-person visit, but does it make healthcare more accessible in those areas, for example, where currently there isn't that many doctors available? Does it provide a service that wasn't there before? What was the intention? Was it mostly convenient, or was it also to reach out into markets and areas where they do not have access so easily to healthcare services?
Right. And in reference to rural areas, a lot of rural areas lack access to certain specialties. So in the early times when telehealth was first, or telemedicine, that's what they call it at the beginning, first came amongst us, it was to actually solve that particular problem. Provide access to those rural areas who lack access to specific specialties in a community. So that's what the totality of it was. Because in order, can't have a person there physically to actually, put their hands on a patient. But if you can reach out and get a consult, a virtual consult, where that physician can put their eyes on the patient and speak with the actual person that's with the patient and provide them with the proper recommendations. And then that clinician that is actually at your facility can make sure they do what's best for that patient in that need of care. So that's specifically what it is, but on the hospital side, it's more urgent. And on the ambulatory side, like the urgent care piece, it's about the non-acute situations, the small things, and of course, if you need to call 911, if it's serious, you need to go to the doctor. But for all those things that, we've all experienced throughout our lives, or you may have small children, things may happen to them. And if you go to a doctor's office and you sit in there for 2 hours, they're just going to tell you, we can't do anything about it. Right. But it's just the ability to have that doctor virtually who you can talk through the situation, and they can actually see your child or even see you in a situation, and get a good understanding of what needs to be done. And it really helps, people especially people with mobility issues, when you're dealing with the 65 and over population, and the real people with multiple chronic conditions, leaving their house or leaving their place of care may be tough. So having the ability to connect with someone virtually and provide a consult virtually is very
right. To be tough, and then also like that same age group right now with COVID, right, is at the highest risk, and to minimize contagions and things like that. So what does someone need to begin using telehealth? Like, what's the technology involved? I guess we could go from the simplest, as far as if I'm a patient and I want to join, what do I need at my disposal? Not only technology wise, but what should I have? Is it like a thermometer, or what types of things do I need? And then also the higher end of the technology, things like like securing patient privacy, security elements, and all that's involved? What's the tech?
Well, if you're a consumer trying to get into it, technically, all you need is an iPhone or iPad or computer, right? Because, there are companies out there like Teladoc, American Well, MD Live, and those are really the big brand direct-to-consumer telehealth vendors. And if you have an employee-sponsored healthcare, most of those have already partnered with one of those groups, so it's accessible to you now via your healthcare provider. And but all you need is an iPhone. But if you're a consumer, a hospital or a doctor, and you're trying to get into this space, of course you would need to look. There's a ton of platforms out there right now, but look for a HIPAA compliant platform that integrates best with this current EMR system that you have. Because just like anything that you implement into a healthcare environment, it has to work with the flow. So having something that integrates well and something that you can operationalize and it can be a part of your everyday clinical and business workflow is very important. And, I don't know how familiar you are with technology in healthcare and hospitals and physician practice, but the electronic medical record, the EMR, is like the brain of everything. So you need to get something that, for one, that can integrate with your EMR and that's easy for your clinicians and doctors to use. Because if it's easy for them to use, they will continue to use it. If it's difficult for them to use and it causes them a lot of time and headaches and pain, you may have a little issue with getting your utilization where you would like it to be. So just make sure you do your due diligence on the front end to really understand what technology you're going to implement and make sure that you operationalize and optimize your workflows before you actually go live with a particular program. But yeah, so you can go from, telehealth carts that cost $50,000 that rolls around a hospital by themselves all the way down to, a smaller cart that you can stick an iPad on and download, or have a vendor like MD Live or Teladoc or whatever vendor you would like to go with on that particular tablet and still be able to provide the same type of care. So it just depends. Now, if it's in an acute care situation, of course, it has to be a Class A certified medical device to be used in that instance. So if you're monitoring vitals and you have all these different peripherals, Bluetooth-enabled peripherals hooked up to where it's then feeding information back to another platform, then you have to go with something a bit more with more bells and whistles. But from an ambulatory perspective, you really only need an iPad with the right software technology on it that's HIPAA compliant, so you don't have to worry about patient privacy. And a lot of these vendors are HIPAA compliant, and they had to become HIPAA certified to be able to sell in the market.
So Josh, I want to shift this a little bit to understand the business impact of this. Mm-hmm. So we get the accessibility component for consumers, mm-hmm. basically eliminating the problem of having access to healthcare, at least not for emergency care, but for immediate care, you certainly have access to a number of solutions out there. Most insurance companies actually provide that as a no cost benefit, which is great. Right. From the business point of view, if I'm a health insurance company or I'm a hospital group or a doctor group or private practice, what are the implications in terms of improving, number one, my ability to serve my patient base? And two, is there any cost benefit or business benefit to trying to move or front most of the initial perhaps visits through telehealth? What's the business impact or the ROI for moving in this direction?
Now, see, that's the ROI is a tricky word. But how I look at it is, of course, there's many benefits from a business perspective when you implement virtual health into your environment. But it just depends on your particular business and how you operate. So just like any other tool that a business owner may incorporate into their business to either improve their revenue or either cut costs in certain areas, that's what telehealth can do too. So for every organization, and what I say is, what works for one organization may not work for the next organization. So you really have to have a good understanding of from an operational perspective, a financial perspective, where you lie and where your issues are, and then you utilize the technology to mitigate those issues. Which in retrospect, when we're talking healthcare, let's say, for instance, if you're cutting costs and supplies and physician travel time and all the other things that come along with the doctor providing care, you're saving money for your organization. If you're expanding your access to your patients, which means you can now expand your business into markets that you were no longer that you weren't able to gain revenue from before, you're increasing your revenue that way. So from everything from expanding access to care to increasing your market share to cutting costs across the board and actually increasing your provider's productivity, telehealth can help you do all of those things. But it's specific to how your organization operates. It's not like a one Band-Aid fits all approach like the healthcare industry has been for so long. You really have to look at your organization, do a thorough assessment, and then use the technology to mitigate the issues that you're currently having.
Right. So it depends on the what you're trying to accomplish. Whether it could be a number of things. You might want to improve the quality of care, or the reach of care, or the quality of life of physicians in terms of their accessibility, et cetera, et cetera. So that totally makes sense. Now, what has happened since COVID is, I'm assuming there has been an explosion of demand for this kind of solution. And are hospital groups and doctors groups rushing that weren't ready for this to get on board? What's it been like for you guys for the past 3 months?
Well, it's been very busy. And due to all the different regulations and things that have been relaxed over the past few months, it has really given physicians the ability to mobilize and scale at a rapid pace, right? So with the HIPAA laws being relaxed and Medicare kind of easing up on their reimbursement requirements and making it more accessible for physicians to actually provide the services of being reimbursed for it via telehealth, and even for the Medicaid plans and all the different states even relaxing their requirements, it has really opened up the floodgates, right? Because realistically, physicians had to react fast because a lot of organizations were seeing anywhere from a 30 to 50% decrease in revenue due to COVID because people were canceling appointments. No one was leaving the house. So when you're running a healthcare facility, you have to see your patients somehow so you can continue to, for one, care for your patients, but also get the revenue through the door. So in the past 2 months, man, it just exploded. I mean, the adoption rate has, just shot out of the roof because, again, physicians really had no other choice. Healthcare organizations had no other choice but to connect with people virtually. So utilizations went from like 40% to 175%. Organizations I know where they were traditionally doing around, let's say, 5,000 visits annually. There's organizations now who've done like 30,000 visits in that short amount of time. So you can really, that just gives you a kind of a sense of how quick people really spent up these programs. And now a lot of organizations didn't go out and properly source HIPAA compliant telehealth vendor or telehealth product. They, due to the HIPAA laws being relaxed a tad bit, they were able to use, things like FaceTime, Google Hangouts video, and Skype to administer these visits, kind of similar to what we're doing now. But, when things kind of get back to normal, a lot of those things will probably roll back from a HIPAA perspective because it's not safe to do that due to all of the possibilities of infractions. But they will need to really look at a program and really try to think through the process of where will my organization stand after COVID and what type of virtual presence will we have? Because now the whole entire world has had a taste of telehealth. We as consumers have had a taste of it and really had the opportunity to say, oh, this is pretty cool. I don't have to leave my house. Okay, I just want to do it virtually, right? So every organization has to really think through what is our virtual strategy, what are we going to offer, and what technology are we going to use to administer. So I think
unless you're a hypochondriac, then it's probably the worst thing you can have access to. Every 2 seconds they're calling in for something. Go ahead, Kim. I know.
No, it's fine. We all kind of jumped in there at the same time. I wanted to go back to this idea of a virtual presence.
I think we lost Kim.
No.
Go ahead. Go ahead.
Okay.
We got you. We still got you, Kim.
Go for it.
Don't stop messing with me now. No. So I wanted to talk about virtual presence, which you mentioned. So let's say we've got hospitals, we've got everything. We see this now as the new normal. It's not going anywhere, even when COVID settles. Right. What are physicians, or even us as, whether it's the physician to physician interaction or the physician to the patient interaction, what can we do to increase that virtual presence? What are the differences between a good session and a poor session as far as telehealth is concerned?
I mean, of course, when you're doing something virtually, your internet connection is going to be everything, right? So having a good connection for one throughout the whole visit is critical. But when it comes to an organization having a virtual presence, you have to think about it from a marketing perspective, and how do you maintain or retain your current patient population? If, let's say, you're located in rural Alabama and you have a provider group from Arizona that is currently encroaching in your market share virtually, and due to some of the interstate license compact and other license things that are being pushed down now, providers can now, get licensed in multiple states. So you have to really think about it from a competitive perspective, as if, okay, beforehand, I only had to worry about the organizations in a 60-mile radius or 60, 70-mile radius. But now I have to worry about those organizations, and those organizations offering virtual services, which could probably be some of the things that your organization is offering. And on top of that, organizations outside of your cities or your encatchment area coming in, encroaching your market share virtually. So it's really a unique thing because you have so many companies, retail companies getting into it. You see what Walmart is doing, CVS, Amazon. So many people are jumping into the preventative care business. And as traditional healthcare providers and physicians, you really have to think through that, because that's going to depend on, if you're able to retain your population, your patient population.
Right.
Because okay, go ahead. I'm sorry.
Do you happen to have a particular example or story of a business or a healthcare provider that has done this extremely well, what they did to set themselves apart?
Oh yeah, it's a ton of organizations doing great work in telehealth. I mean, Kaiser, if you're familiar with what Kaiser Permanente has done in the past from a virtual perspective, they've kind of been one of the landmark organizations on top of organizations like Intermountain Healthcare, which they're like the leaders in telehealth in the country. So Kaiser has done a great job. I know at one point in time, and Kaiser's CEO, he recently passed, I think last year, but I was at a Nashville Healthcare Council event, and he was there kind of giving a speak and giving everyone an overview of the things that Kaiser was working on. And at one point he said they had converted, I think, almost 50% of their preventative visits to virtual care in 1 year. So just think about a company as big as Kaiser, and if they were able to do that, and he kind of gave an overview of the things that they've kind of improved in. And then you have Intermountain, who has a complete virtual hospital. Like they're the telehealth group, and they actually provide care to tons of patients virtually, and they have a great setup and a great infrastructure to do so. So there's tons of organizations from for-profit to nonprofits, and you see what some of the federally qualified health centers are doing and the access that they're providing. And then you look at some of the ECHO programs that's happening all over the world, and that's inside and outside of the United States with the ECHO program. So there's a lot of people doing a lot of great work all over the world. And I think what's happening now is really setting the presence for us to continue to push that forward, right?
So Josh,
I have a question, by the way.
Go ahead.
Yeah. Josh, I was going to, earlier on, I was going to ask you about adoption, but you did mention that it sort of skyrocketed for a number of obvious reasons, right? Everything. So, but what I wanted to ask you is that, what I understand that Uniti Health, what you do is basically you help providers to navigate the digital landscape,
right?
So, and also to simplify their telehealth strategy. So, in that context, and in regards to adoption, what would you say that this simplification of strategy, how has it changed, or how simple does it need to be in order to boost adoption, for example, and whether it be technically like from the engineering side, or maybe in the user experience side? What kinds of aspects would you say that need to be somehow modified due to that skyrocketing adoption that telehealth is experiencing? So that's what I would like to ask you.
I mean, on both sides, the usability is everything, right? It has to be easy for the consumers, and it has to be usable for the clinicians providing the care.
Yeah.
I mean, with technology advancing at such a rapid pace, I mean, that's been one of the things that really halted a lot of organizations kind of wrapping their head around from a technology perspective. How do we do this? How do we gather it with everything else that we're doing and make it all work in this big conundrum, right? Throughout the whole continuum of care. in which when you start dealing with different technologies and different platforms and softwares and interfaces, blah, 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 it can get quite confusing. So a lot of that was in pre-COVID, let's say pre-COVID, and let's say 2 or 3 years ago, let's just put it that way. The technology was one of the biggest issues. And it's because the doctors hated it. It wouldn't work appropriately. If the patient had issues, pulling a visit up on their phones or iPads, or if they had a lot of disconnection problems due to the bandwidth and this internet connection, then you would have a lot of people say, well, you know what, I tried, it didn't work. But, with, internet speeds and everyone's putting fiber everywhere, the internet speeds has increased. A lot more patients have smartphones now. So people have some type of similarity on how to use an app, right? So the thing is, I would say the key is to get something that's very usable to the consumer and something that's very easy to use for your doctor and your clinicians. And those are the two things that try to simplify your entire workflow and process to where, as if the patient was coming in for a visit at 2 o'clock in the office, that flow needs to kind of trend right alongside with that. And that's everything from the check-in process to the triage process to the time that the patient spends with the doc to the time the patient leaves the actual virtual visit. And then if any medications are sent to any pharmacies, all those steps that come into play when you're providing patient care needs to be simplified. And I have spent a lot of time working in EMR adoption and optimization, which is the systems that doctors and hospitals use in their clinics to take down all your information and diagnose your medications, et cetera, et cetera. So I've always been interested in that and trying to make it work in a way to where it just, it's just part of the process for it to work. But when you're dealing with technology, you're always going to have a few ups and downs, but just having someone to help you who really understands the ecosystem and understands the EMR and the integration piece. And then also just taking that telehealth piece and plugging it in to what you do to make sure on the back end that, for one, you're getting paid for what you do, and that you're documenting everything appropriately, which is another thing that is very important, because if you don't document appropriately and then you send it off for one of the insurance companies to pay for it, they're not going to pay for it. So it starts from before the patient even comes into the virtual visit to after they leave, to the information is sent to the insurance companies, and you're hopeful that it comes back. So you have to think about workflow and optimization, and just having very user friendly and technology that's very easy to use for the doctors is super important.
So Josh, we're coming up. Thank you, Josh. We're coming up on time, but I do have a couple of questions. So in this case, for sure, the advancement of technology is improving lives, no question about it, right? The better the technology, the better access. The question I have is, with COVID, some of the state borders have been removed in terms of doctors being able to provide services cross-border, right? Whereas before, if you're licensed in your state, and that's all you can provide services for. There's a lot more access because those rules have been removed. Do you see the potential of that sticking post-COVID? Because I'm assuming that if some markets have more healthcare providers than others, well, then you would have a disproportionate access that could be solved with telehealth by removing those barriers. And furthermore, in terms of quality of life for practitioners, they could live anywhere they want to, providing this kind of care without being tied to a specific location. Is anybody pushing for that in legislature to change it so that it's more broadly available instead of statewide but nationwide? What's going on with that?
That's I think I touched on that earlier, but it's called an interstate license compact, and it's a piece of legislation, and multiple states are signing up. And this is happening before COVID, and there's a lot of states that are jumping in and being a part of it. But what it does is the credentialing piece that the providers have to go through when they're either go to another state or when they're getting credentialed with a certain payer. This helps to provide an expedited way of doing that. So the process you would have to go through before if you were located in Tennessee and you wanted to provide care in Kentucky, it will be a long, drawn out process. But now they expedited it to where your state's part of the compacture, then you have access to information to where you can get it done in a very timely manner. So yeah, it's tons of legislation, organization out there pushing for that, and that was already happening before COVID, and I only see it getting better post COVID. because it really, like, kind of like you touched on, it gives physicians the ability to practice across state lines. But also, if I'm a rural, let's say if I'm a urban facility in Nashville, and I know a FQHC that's responsible for about 10 to 12,000 lives in Missouri, and I'm very special. I'm strong in a specific specialty that they're lacking in, and we can create a collaborative partnership. And then I can have my physicians seeing their patients virtually, and their patients are getting the care that they need, and everybody's happy. So it's engagements like that would, cross state licensure and giving providers the ability to do that in an expedited way can really help improve the overall quality of care for patients in a lot of different places.
That's what it's all about, right? That's what it's all about. I guess accessibility and mobility, that's the ticket,
Yes.
Well, Josh, any additional questions, guys? Otherwise, we're up on time. I know we can go on for another hour.
I do have one out there. I guess with this idea of it becoming the new normal and more and more people using this, as we've already touched on, like, it's in a way, it's forced upon us, right? As a mom, and schools being closed and educational platforms, I think there's the same kind of boom and the shift in needing to have it now be as user-friendly as possible. But particularly about what types of safeguards should the users keep in mind? Like, I've heard these horror stories about imposters, right? As physicians, you have, particularly, I think, when it comes to the plastic surgery industry and things like that. What can we do, or what types of safeguards are there to make sure that I'm actually getting the quality care through a platform that is legit?
Right. What I would recommend is just making sure that you go through your doctor's patient portal. Right. Most physician practices have a patient portal, which most of you probably hadn't been using quite often because the adoption has been really low over the past few years, but it's starting to tank up now. But the patient portal is a great place that most EMRs have a really good. Some have easy to use patient portals, but it houses all your information, and you're able to communicate, through a secure messaging aspect with your physician through the patient portal. And a lot of organizations are leveraging their patient portals to, confirm the appointments, confirm the virtual visit appointments, and the communication is going through that one platform. So it's very important that you use that patient portal to your advantage to communicate with your doctor through a secure and encrypted platform. But also, of course, once that patient portal provides you with that link to, go in, and sometimes you have to log into the patient portal to actually go to the virtual visit. Make sure you follow those processes and procedures. And just like anything else, make sure your passwords aren't 1, 2, 3, 4. Because even if you do have a patient portal and someone has the ability to get on your account, which is possible, you need to make sure you have a good, strong password so you can stop the hackers from getting in. But most of the organizations that I've worked with and the people that I see, especially the larger ones, they're doing a lot of communication through the patient portal. So just make sure that the patient portal you're utilizing is your doctor's office's patient portal.
Right. As always, starting from a trusted source from the very beginning.
Exactly, from the very beginning. Exactly.
Perfect. Well, thank you
Josh,
so much.
It's been a pleasure to have you on the show. We're up on time. I think your dog might be calling you saying, "Hey, you're up on time."
Yeah,
as well. I'm like, guys, who's got a dog bark? You mute yourself. We're like, it's Josh. Welcome to the new. I hate you. Carlos hates using the new normal. I like to use welcome to the temporary normal. The temporary normal.
Temporary normal. Let's call it that.
Hey, that's what makes it real. That's what makes it real, right?
I was hoping it was temporary, but it looked like this stuff is going to stick around.
It's like, it's time's up. Time's up. That's what he was saying.
Well,
it's been a pleasure to have you. Thanks for joining us today.
Thank you.
Carlos, what do we got coming up this week?
Yeah, actually,
we have one more show, right?
We have one more show, and this is on Thursday. And let me tell you who we're going to be having, actually. And Thursday, at 1 p.m. Pacific, we're going to be speaking with Sam Xia. He is the CEO, the CTO, I'm sorry, and from Wikipro. Wikipro. And we're going to be speaking about business-to-business communication platforms, which is all relevant because of the many changes that a lot of businesses are experiencing nowadays, and the challenges in communicating with customers. So that's where we're going to be speaking with Sam
Okay, cool.
Xia, CTO of WikiPro, 1 p.m. Pacific, right here in Dojo Live on
All right.
Thursday.
Awesome. I might have to join that one. Sounds pretty cool.
Absolutely.
Yeah, please.
All
Well,
right,
pleasure to have you, and thanks for joining us, everyone.
Thank
And
you.
we'll see you Thursday.
All right.